This presentation will demonstrate the muscles of the lower limb. So first let's talk about the gluteus maximus and gluteus medius. You are probably familiar with the term gluteus maximus, but the gluteal region is the buttocks area, and the fact that it is called maximus means it's the largest. Medius is actually the medium size, and there is one that's called gluteus minimus, but we would have to take off the gluteus maximus and medius to see it. And so here's the major, the gluteus maximus, the largest muscle of the buttock area, and our gluteus medius kind of goes straight up and down underneath it. Another little tiny muscle that we see is the tensor fasciae latae. Now I always think of that as, it sounds like a fancy coffee drink, but it begins here at the iliac crest, and the muscle itself is very short, and then it kind of connects to the tendon here of the gluteus maximus, and then it extends down to the knee as what's called the liotibial tract. The flexors of the knee are on the posterior side, so we know knee flexion is making the angle smaller, and these are called the hamstrings. And there are three muscles that make up the hamstrings: the biceps femoris, semitendinosus, and semimembranosus. All three of these muscles have an origin on the ischial tuberosity. And so the first muscle on the lateral side is the biceps femoris. And so biceps meaning that it has two heads, and so here's one head and two heads. Femoris meaning that it's attaching to the femur. And so be careful that you can't just call it the biceps, because how do I know whether you mean the biceps femoris or the biceps brachii? So we have to include both of those terms. So the biceps femoris is the muscle on the lateral side. On the medial side we have two. We have the semitendinosus and semimembranosus. And of those two, I remember the semitendinosus because the tendon of this muscle is on top. And then underneath that is going to be the broad semimembranosus, the much broader muscle, kind of forming a membrane. So those are the three muscles of the hamstrings. If we turn the leg around and looking at it from the anterior side, we have a couple different muscles here. The very distinctive one is the sartorius muscle, and that starts here at the outside and it crosses the thigh and goes to the inside or the medial side of the knee. So this is the sartorius muscle. And it actually means like a tailor, and the cross-legged position is sometimes called tailor sitting, because the idea was that to make your leg go into that cross-legged position, a tailor would have sat in that cross-legged position to make their clothing. So that's why it's called the sartorius muscle. Then here at the medial side we have a gracilis muscle. And so when I think about this, it forms a triangle. I have my sartorius, I have the gracilis, and then this muscle, or sorry, this ligament right here is called the inguinal ligament. Another large muscle that we can see here is we see the kind of the distal portion of what's called the iliopsoas. It's actually two separate muscles, the iliacus and psoas muscles, but they come together and we usually just call it the iliopsoas. This is actually a hip flexor, but they start way up high on the ilium and the spine and come down and attach to the femur. Here we can actually see that iliopsoas again. You can see how it attaches to the spine here and the anterior surface of the ilium, and they come together and attach here at the lesser trochanter of the femur. So this together is called the iliopsoas muscle. The other muscles that we see here are the adductor muscles. We have adductor magnus, adductor longus, and adductor brevis. The adductor magnus means it's going to be the largest muscle, and we can see part of it here, and we can see part of it here, which means that it also goes behind these other muscles. So the largest one covering that entire medial surface of the femur, and then it attaches here at the on the coxal bone there. Then we have the adductor longus, so from the pubic bone here down to the femur, is a little bit longer than the adductor brevis, which comes shorter. It's shorter because it comes and attaches higher on the femur. And because these are all adductor muscles. They are bringing the knees or the legs closer to midline. And here we can see the gracilis muscle that went straight up and down on the medial side of the thigh. Another muscle in this area is called the pectineus, and here is that inguinal ligament again, Sartorius, Gracilis, and then this muscle is the pectineus muscle. And if I look at these three, starting with the gracilis, they form the word gap. So Gracilis Adductor longus, that's the only one that we can really see in this picture, because remember the adductor magnus is the deepest, so we're not going to be able to see it at all, and we really won't see the adductor brevis either. And then, so gap, Gracilis, adductor longus, pectineus, and then here was that iliopsoas. We talked about flexors of the knee being the hamstrings. The quadriceps are the extensors of the knee. And here we have four muscles. We have the rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. And so here we have the rectus femoris. Remember that word rectus means straight, so it's the straight muscle of the thigh. Then we have the vastus lateralis, this vast meaning large muscle on the lateral side of the thigh. Vastus medialis, this large muscle on the medial side of the thigh. And then in this picture we can't see the vastus intermedius because we would have to take away or lift off the rectus femoris, but know that that's where it is. It's right underneath this, this rectus femoris. Now all four of these, the reason it's called quadriceps means that four heads. The heads actually have specific names, but all four of them are going to come together onto the patella, and they're going to continue down through the patellar ligament onto that tibial tuberosity. Okay, lower leg here on the posterior side we have a muscle called the gastrocnemius, and it's this large calf muscle here, the most prominent calf muscle. And if you were to wear high heels, then this muscle looks more muscular because just of the way that the orientation of the thigh, or not the thigh, the lower leg and the foot makes it look more muscular. Now underneath that we have a relatively flat, large muscle here, and we can see it a little bit on this side as well, and that's the soleus muscle, and it goes from down here all the way up to the top behind the gastrocnemius. Here on the side, I'm looking at the lateral side, and I can tell that for one thing because there's the big toe. So this is the lateral side of the leg. And I'm going to look for the tibialis anterior. So I know the tibia is the largest bone of the lower leg, and it's what makes up the shin. So we can actually see the bone here. So the tibialis anterior is just to the side of the tibia. Now if I look right behind that, I'm going to have a muscle called the Extensor digitorum longus, and as I follow that tendon down here, I'm going to see that it goes to all of the toes here, this Extensor digitorum longus, and that's right behind my tibialis anterior. Now specifically the hallicus is the big toe. This is a picture from a different source, but here's your tibia, your tibialis anterior. We talked about the Extensor digitorum going to all of these toes, but the big toe is right, the Extensor hallicus longus is this muscle right here, just in between those two tendons. So here's the tibialis anterior tendon, here is the Extensor digitorum longus tendon, and then there is the Extensor hallicus longus muscle. Now the tibialis posterior, we know this is the medial side, there's my big toe again, and the tibialis anterior was this large one on the lateral side. The tibialis posterior, the only part of it that we can see is this little portion down here behind the tibia, and of these muscles it is the deepest, and so it's the hardest to see. This is the gastrocnemius, here is my soleus, and then I have the tibialis posterior. Again, on the lateral side, I have two muscles called the Fibularis longus and Fibularis brevis. I like those terms. There are going to be some sources that might call it the Peroneus longus and Peroneus brevis, but I like the fact that this says Fibularis because it tells me which side of the leg it's on. This is the head of the fibula. Remember, it's not weight-bearing, so it's a little bit below the beginning of the knee. And so here's our Fibularis longus, and it starts all the way up there at the head of the fibula and extends down towards the foot. And then the Fibularis brevis it looks like it's kind of behind there. So here's that tendon of the Fibularis longus, and then behind that is the Fibularis brevis.